Hello, everyone. Hello, basketball coaches. Um, it's a pleasure to share my experience with you about main basketball injuries and main time situations and factors causing these injuries. My name is Laimonas Siupsinskas. I'm a sports physiotherapist working with the Lithuanian men's national 5-on-5 and 3-on-3 basketball teams. And today I'd like to share my experience, my point of view to the injuries happening in basketball, how to prevent them, and covering properties of these things according different age. And I would like to start my presentation. So first of all, I just want to emphasize that the good athlete, the healthy athlete, is the athlete which has the balance between health and performance. Yes. So if we're able to hold that balance in neutral position, we have good career, we have good results, we have long career without any injuries and so on. But we know sometimes these injuries are happening, and I would like to start from the basics about the injuries, the definition of injuries, type of injuries, and so on. So this is like a ideal way of keeping the athlete healthy and in good performance. Yes. So I'd like to say words which I strongly advise to remember. Scott Morrison told us that most injuries occur from doing too much too fast after doing too little for too long. So these words are not 100% good in all situations, but especially talking about overuse injuries, it's very 10 points words which we have to remember. But let's start from the beginning. And just I want to start from the definition of injury and illness. And according to International Olympic Committee Manual of Sports Injuries, sports injury may be defined as a damage to the tissue of the body that occurs as a result of sport or exercise. Actually, we have different situations of the injury, which is important for you as a coaches. So first of all, I think the biggest problem is when we have the injury which causes the time loss. That means that the player is not able to play, to train, missing a match, competition or championship, and so on. So in most cases, the injuries, in most cases, musculoskeletal injuries are named these situations when the athlete is not able to participate in training sessions, or it's not able to participate in matches. Also, there are some situations when injuries needs medical attention. That means that the player is able to participate, maybe not 100%, but he or she is able to play or to train. But medical attention is needed just to prevent from the more serious injury. And the last one is any complaint from the player concerning the body, the health in general, and so on, which actually supposed to be analyzed by the team physician or physiotherapist or any other medical personnel, or the coach if there is no such a medical personnel in the team. So in most cases, these complaints be analyzed. Are they serious or no? Do we need to adjust the training load, or maybe just stop from training and from the competition? So I think for you, for the coach, is the most important thing which the coach wants to know. Is it the player able to play and to train? If not, what to do next and for how much time he's out. So I think it's in most cases these things are important, but we should not neglect any other complaints which can be the first signs of the problem. So ways to classify sports injuries can be based on different situations. The time taken from the tissues to become injured, tissue type affected, the severity of the injury, and which injury the individual presents with. So classification of the sports injuries is presented in this table. I don't want to get into medical details explaining all the words, but talking generally, we can classify injuries in acute injuries and overuse injuries, and the site of the body, which body parts are affected by the injury. Is it bone, articular cartilage, joint, ligament, muscle, tendon, bursa, the fat tissue, nerve, skin, and so on. But I think the most important thing is to remember that the injuries can be classified to the acute injuries and overuse injuries. Acute injuries usually occur suddenly to previously normal tissue, and acute injuries occur due to sudden trauma to the tissue, with the symptoms of acute injuries presenting themselves almost immediately. Yes, so acute injury is something which is happening suddenly. Yes, and these acute injuries can be classified as a direct or indirect, but we will talk about it soon. So direct or contact injury is usually the situations on the court when we have the external blow or force, the extrinsic causes, maybe the collision with another player, yes, or another object. So actually this is the situation when there is contact with someone, or it's a human, or it's something else, just jumping on the ball or something like this. So it's calling direct or contact injury. Indirect or non-contact injury actually can occur in two ways. It's in most cases is intrinsic causes, and usually is something which is happening on the court, the situation, the injury situation, when there is no any external forces which are forcing the player to fall down, for example, on the outstretched hand, and dislocated the shoulder, or just running fast and stopping at the moment, and something pops in the leg, in the knee, or something like this. So usually these things are these things which we are usually analyzing, because indirect or non-contact injuries are the most let's say popular injuries in basketball, which we can prevent actually. Yes, so the causes of these injuries can be poor technique, fatigue, lack of fitness, for example, muscle strain or ligament sprain, and so on. So in most cases, we're supposed to analyze what has happening and just find out the weak link in the body which is causing these things. So overuse injuries, usually the injuries of any repetitive activity which leads to the overuse injury, And overuse injuries occur over a period of time, usually due to excessive and repetitive loading of the tissue, with symptoms presenting gradually. Little or no pain might be experienced in early stages of these injuries, and the athlete might continue to place pressure on the injured sides. So actually, the micro injuries, which are usually named by the player, which are not serious, it's a little bit hurting, but it's okay. I will manage to continue. But usually these are the signs which are telling that something is happening, and if this situation is long lasting and there is no time for the body to heal these micro injuries, it can lead to more serious over injuries, which should be treated for a long time. So actually the principles in overuse injury is that repetitive microtrauma overloads the capacity of the tissue to repair itself. And overuse injuries, the causes of overuse injuries can be intrinsic and extrinsic. Intrinsic factors is, for example, age, physiology, lack of flexibility, muscle imbalance, weakness, fatigue, anatomical, size of the body, sex, body composition, and so on, leg length disparity, and other things like genetic factors, endocrine, metabolic condition. And extrinsic factors, usually it's the training errors, equipment, environmental conditions, playing surfaces, psychological factors, inadequate nutrition. So as you see, overuse injuries also can occur with not proper training, training errors, and so on. So I will talk about it in my presentation later on, and I think this is the situations which can be managed if we know some basics. So we know this lozung of the Nike, the basketball never stops, but we know it stopped, yes, at the moment. And it's the serious situations, and actually I'm a little bit afraid of what is going to happen when it's going to start once again in full volume, let's say like this, yes. And we don't have any lot of data, yes, right now. But for example, in 2011, after the NBA lockout, the scientists noticed that number of injuries increased, and some of them is telling that okay, this is the problem, and we should not stop training because it's leading to injuries. But in other cases, usually it's the combination of different type of things. So actually we have such a data, and we don't know at the moment what will be the data after the COVID situation, but I think in especially in youth basketball, there will be a lot of problems, health problems, when the people will get back to the training. So we have to be aware about that. So talking about most common injuries in basketball, so the majority of the injuries in basketball are focused on lower extremities. It's about 62%, and it's the data from the National Basketball Association 70 years overview, which was published on 2010. On 2010, and this graph here is showing average number of injuries per season. So that means how much injuries were registered. And in red color, we see the average games missed per injury. So it's very interesting that usually the most popular, let's say like this, injury is ankle sprain, patellofemoral inflammation, lumbar sprain or strain, hamstrings, and so on. But this is the injuries which were not leading to the missing the game. So what kind of causes are missing the game? So it's lumbar disc degeneration, it's foot fractures, it's meniscal tears, it's ankle fractures, and other things. So actually we see that it's a little bit different situation. A lot of ankle sprains and knee problems and back problems, but the games are missed a little bit different reasons. So we need to know that yes, the injuries are happening, but I think the most important thing for the coaches is the player able to play, and another thing is it able to play 100%. So in most cases, the ankle sprains and knee problems and so on is limiting the performance of the athlete. So that means that yes, the athlete is able to play, but not in 100. So actually, this is the problem which the coaches is phasing in. So another data from different type of sources of statistics. So about 25% of all basketball injuries are ankle sprains. So we know that elite players experiencing a lot of more injuries during the playing hours, but also there is a number of injuries. So actually about 2 injuries in 1,000 hours of training and playing is happening in youth. And also there is a statistics of the top injuries in the NBA for the season of 2014 and 2015. So as you see, knee and ankle are the most common injuries in the body. So for those who are interested in the statistical information, you can analyze the injury incidence rates in children and youth and NCAA athletes, overall range, game range, practice range. So as you see, in general, we can see that much more injuries are happening during the matches, and it's about twice less injuries in practice. So the majority of the injuries is happening during the game. So it's also very important information we need to know. So what kind of risk factor for injury? So for example, talking about ocular injuries, nail length, wearing contact lenses, finger injuries, contact with the other player, impact from the ball, ankle injuries is overuse, jumping, landing, pivoting, changing the direction, running forwards and backwards. Any injuries is overuse, also jumping, landing, pivoting, cutting, changing the direction and contact with the other players. So as you see, the injuries are happening during the main basketball movement. So yes, so it's quite difficult to prevent it when the majority of the things are happening during the basic movements in basketball. So, and it's for those who are interested, you can check how much injuries had Kobe Bryant and how much games was missed because of the different type of the problems and just from sprained shoulder, viral infection or flu and so on. And it's also interesting to understand that highly professional, best of the best player is also facing with the injuries, and it's a part of the life. But the most important thing is that yes, the injury can happen, but how we can prevent it, and if it is happening, so how to treat it fast and well. So we have some data in Lithuania. We just did the research, analyzed injuries happening in female basketball players of our highest league players. We have analyzed number of injuries. We have monitored 351 female basketball players. So we have total about 400 injuries during these seasons, and we have noticed that number one problem in female basketball was the knee, and the second place was the ankle. So it's similar, but it's a little bit different. So in our case, in our population, the knee was the biggest problem in female, and it also fits with the data from other countries and so on. So sex is also having the influence. So usually the male players are suffering mainly from the ankle sprains. So the female players are suffering from the knee problems. We have to remember that. So load management and injury risk, the very important thing which I want to emphasize. So when we are training and developing the athlete, the art of training is keep the person in sweet spot when the injury risk is as minimal as it can be, but we are having how to say, we're having improvement in training. And if we are increasing or decreasing training load very fast, we can come into danger zone when the injury risk is increasing. So load management is very important thing, and I will talk about these things later on. So when we are talking about the capacity of the body, the physical capacity and the time, it's very important to know the floor and the starting point, and we have to know what is the ceiling of the training load. Yes, so the floor is usually known because we can test the players, we can see what is the initial position of the player, talking about physical performance, but it's very important to know what is the ceiling and when it should be. So usually the strength and conditioning coaches are asked to prepare the team just to be in the peak of the performance when it is needed, when they are very important matches, and how to train all the season just in order to get to the peak when it is needed. So it's really art to do it. So I like the expression of Andrea Spina. So actually, when the load is bigger than our body capacity, usually we have the injury. So when we are pushing too much and the capacity is not enough for that training load, we will have or we will have in future the injury which will happen. It's just a matter of time. When we are decreasing the load and maybe it's equal to the capacity, usually we're having the situation in rehab. Yes. And when capacity is bigger than load, we have the prevention. So it's not easy to get into this point when we want to have the improvement during the training, but these things should be done in the proper way. So I just want to cite a very nice expressions from the coaches. So planning is an art that requires science, creativity, and common sense. And on the other hand, we shouldn't mathematize the training. Never lose your observational ability. Look at the player, look at the practice, look at the game. So we have a lot of tools how to analyze, how to monitor training load. But I think every coach is having this observational ability, yes, and you should be able to see from the reaction of the player on the court, from the behavioral things. Is that okay? Is it too much? Is it less? And so on. So of course we can calculate everything, but I think the most important thing is this observational abilities, and and everyone should be improving in that. Yes. So I want to just to get through four main things which I want to emphasize in this lecture. So I want to talk shortly about health status of the player. I want to talk about physical load. I want to talk about load management and physiological adaptation. Well, these things are very important in terms of injuries, in terms of the development of the healthy athlete. I think this is very important thing. And maybe you have noticed that in most cases I'm using the word athlete, not the player, because I think that that first of all, especially when we're talking about youth and kids, the main objective of the coach should be first of all develop the athlete. And if you have the good athlete, I think you have the good possibility to grow up a good player. So background and the basics should come first, and later on you should build the player with them proper skills. So I will return to these things later on. So let's start about health status of the player. About very in a simple way, I want to cover these things. I think that the most important things talking about the health status in general, we need to pay attention to the anthropometrics of the player. Yes, it's very important. Is it the big one? Is it the guard or the other position player? Another one, we should assess the movement, and also we should pay attention to the general physical fitness. Yes. And very important thing, I want to emphasize the psychology. Yes, psychology in general, the motivation and all these things. Yes, and sometimes we have to understand how the player is feeling after the injury. Yes, so common athlete reaction to injuries is identity loss. Yes, fear and anxiety, lack of confidence, performance determinants, and group processes. So knowing that, we supposed to communicate with the player a little bit differently, which is injured at the moment, and we have to understand him that he is frustrated now, and we have to encourage him to be a part of the team. So I personally, I think it's a good way to keep the injured player with the team, go to the matches, sit on the bench, participate in the life of the team, and just to get to stay in the team and to stay in that atmosphere. So I think it's very important, and use it especially in kids and youth basketball. So anthropometrics, what are the important things? I think height and weight, yes, it's important. The body composition, but in terms of muscle and fat ratio, if it is possible to measure, yes. Wingspan, leg length, growth spurt, and puberty. So these things actually giving the children in not equal position as it's seen here in the picture. So it's very important to analyze, to check these things, and to plan how it's going to be in the future. Movement assessment. So I think one of the most important things that we should assess quantity versus quality. Yes, so that means that first of all, I think we have different type of tools how to assess basic functional movements, which are not basketball specific movements, but this is the movements which we can assess just to analyze. Do we have any problems in basic movements? Yes. And later on, of course, we can check basketball drills and so on. But my point of view here that the quality should be first and the quantity should be second. So analyze the quality, and it's very important to check this. And I like that performance pyramid which you are seeing in the slide, that when we are developing the athlete, the background should be the movement quality influenced by the mobility and stability. So the quality of the movement we can assess in different ways. The physios, the sports medicine doctors having different type of tools to do it. When we have no problems here, we can start performance things. So just developing endurance, strength, speed, power, quickness, agility, and coordination. And when the athlete is good in these things and having these things in a complex way, we can add skills, sport-specific skills. So if all these things are done step by step, not missing the block, I think it's the first step to the long-lasting, successful, and injury-free career, if we are doing that in that way of the player. So if we, for example, if there is a pain in the knee during the squat, so I think that just a matter of time when it will appear on the court. So that means that if the player cannot do the squat properly, do we need to improve vertical jump or work on the power, agility, or quickness if there is a limitations in basic movements? So I think no, because if we will do that, so it's just a matter of time when the injury will appear. So as we see here, yes, maybe the anthropometrics are very good, maybe very promising, but the body and the observational things are showing that okay, maybe this is the highest youth player, which giving a very bright future. But on the other hand, for me as a physiotherapist, I see different type of things which are telling me that okay, I think this is not the proper way of the posture and different type of things, and the risk of injury here, different type of imbalances and so on. This person can have some risk in future, as you see, as a house which is here, and here, take a look here, it's also the basket here. Yes. So I just want to emphasize just main physical fitness in basketball. Of course, this is the field of the strength and conditioning coaches, but shortly, just to emphasize 5 things that every basketball player needs: the aerobic capacity. It means that cardiorespiratory endurance, anaerobic lactic capacity, also jump capacity, different type of jumps, vertical, horizontal, or repetitive, and of course speed and agility. So these things should be trained, and all these things should be trained at the same level, trying to get some exercises and drills for every step of the physical fitness. So physical load. Yes, just let's get to the second point, physical load. So training load or physical load can be divided into internal and external. So internal physical load is when we are analyzing how the body reacts to the movement, and it can be assessed like pulse, like training load, volume, creatine kinase, lactate, and different type of things. The external load is distance, number of sprints, biomechanical load, 1 repetition maximum, and all these things can be analyzed as a volume, intensity, and time. So we have two things, internal and external training load, which is important to monitor and important to know. So internal training load, for example, biomechanics. Yes, when we have different type of situation when our joints, tendons are loaded. Yes, different type of situations. When biomechanics matters, and from the video analysis of different type of injuries, about half of the injuries are actually very strange, because the mechanical load from the analysis, from the video analysis, was not so obvious. And for example, Kristaps Porzingis tear of the ACL, if you will look at these things in video, you see that it looks like nothing happened, but he landed on a stiff extended leg, and it was enough just to torn the second strongest ligament in the body. So biomechanics and certain circumstances are important to know. And another one point, metabolic training load. It's related with the level of cardiorespiratory fitness, which we have to also just analyze it. So load management, how to do it, and how to calculate it, and how to do it properly. Yes. So load management actually depends from the status of the player, general health status, play time, and the position of the player. Yes, so it actually basketball is the team sports, but from the point of view of the body, this is the team which quite different people, talking from the physiology point of view. So that's why load management should be a little bit individualized, and I think that it doesn't matter that the basketball is a team sport. We should individualize it as more as we can. Yes. So very important things to know, that acute and chronic workload ratio. Very simple way to calculate. Are we having are we on the proper track? Uh, just thinking about training load in total, because we know that we can analyze this ratio. Acute workload is usually the things which were done in the last week, and the chronic workload is all the things which was done last month. And we have the table just to how to know from that ratio. And in the next slide, I will explain how to do it and how to analyze it. It's a simple, very simple way do it properly. Yes. So acute and chronic workload. If we will do the calculation, so dividing acute workload by chronic workload, last month workload. So if we have more than 1.5, we have in danger zone. That means that our workload is increasing too fast and too high. If we have 1.35, okay, we are increasing the workload, but it's okay. If it's from 0.8 to 1.3, we have the optimal, the stable training load. That means that we are not increasing, we are not decreasing, we are having the same workload during the month. And if it is less than 0.8, we have the decreasing workload. So depending on these things, we can monitor, are we going up, are we stable, or maybe we are decreasing. And we know that from the point of reducing injury risk, if spikes of training load is more than 10%, it's related to the increased injury of tissues, mainly talking about overuse injuries. So, for example, just few examples just to see how simple is that. On average, for example, every day your players are running 8 laps on the last week every day for the warm-up, let's say like this. But on average, 6 laps of running during the last month. So that means that usually during the last months you are asking to run for 6 laps, but the last week you have increased it to 8. Is it enough or is it not? Maybe let's move on to 10, for example. So 8 is very good because the ratio is 1.33, which is telling that it's optimal, stable, but it's coming maybe to the limit of increasing. So that means that you are not you are doing it properly and not too fast. For example, on the average, the last week you asked the players to perform 15 squats, but on the average of the month you was asking to do 25 squats. So the ratio is 0.6. That means that your workload is decreasing, and it means that the players are in the under training situation. So fast increase or fast decrease of training load is associated with increased risk of injuries or health problems. So it's very important to know, and here this is the same things which are written. And now let's understand how to rate the perceived exertion. Yes, RPE. So usually very simple ways to know how intense was your workout. And this is the question you can ask of the player after the workout, or maybe after the drill, or after the running, and you can just ask and use that 10 points rating system, which 0 is resting and 10 is maximum exertion. So the question should be, how intense was your workout? Yes. Usually the best way to ask that question is 30 minutes after training session or game. It can be after the shower or in the bus. So you should not be monitoring the intensity of the workout directly after workout, because just directly after the training, your central nervous system is sensitized, and that means that this is not the true situation which our brain can analyze. And another tip, always ask the same question and use the same words. So very simple way to know what was intensity of the player of and what was the perceived exertion, rate of perceived exertion. Yes. So this is the example of the training session. And here we have arbitrary units, which I usually used to do the calculation during one training session. So dynamic warm-up lasted for 10 minutes, and the player rated as a 6. So you can multiply it and you see the 60. Later on, there was the plyometric drills, 5 minutes, but the player rated it as a 8. And also multiplying agility drills, shooting, defensive drills, offensive situation drills, scrimmage, conditioning, and so on. So when we are asking about these things for the player, asking him to rate it, we can calculate arbitrary units during one training session. So if you are doing it every training session, you can do these calculations, just putting these arbitrary units to the acute workload and chronic workload, and you can see, are you doing properly? Maybe you need to slow down the process just to prepare the team for the peak after 2 weeks, and maybe it's not a good idea to push them too much. So it's very important to not to cross 10% spikes in training load. So this is the example of the rate perceived exertion. It's not only running, it can be also weightlifting, also it can be cardiorespiratory endurance. So actually we can use the scale in all the training load situations. And physiological adaptation, yes. So a lot of things is having the influence to our physiological adaptation. I don't want to get through the exercise physiology, but the things which are very important. So basketball, of course, yes, it has the impact on our physiology. Level of physical fitness, sleep time, nutrition, family, school, psychology, and a lot of other things are important here, which are having the impact of our physiology. Just want to talk about quite funny thing from the first view, the amount of sleep. And we have evidence that optimal amount of sleep is associated with the risk of athletic injuries. So athletes who slept less than 8 hours per night were 1.7 times more likely to have had an injury compared to the athletes who slept for 8 hours or more. So we know from the researchers that kids from 5 to 10 years old should sleep 10 and 11 hours per night. Adolescent from 10 to 17 years old should sleep 8.5, 9.25 hours per night, and adults from 7 to 8 hours per night. So some data from the NBA player performance, the same, those who were sleeping 8 hours, and those who slept less than 8 hours. So very interesting data was analyzed. So those who were sleeping more than 8 hours had 12% increase in minutes played, 29% increased in points per minute, 2% increase in free-point percentage, 9% increase in free throw percentage, and 37 increase in turnovers, and 45 increase in false commitment. Those who had less than 8 hours of sleep. So quite interesting data, yes. And also, to be more accurate, talking about the injury risk, those who slept 6 hours per night had more than 70% risk of injury, and those who slept 9 hours having about 18 risk injury. And of course, a lot of things are related with the sleep. So aesthetics, body composition, health in general, performance, mental performance, strength, power, aerobics, and cognitive function. So actually, it's quite an important part of the recovery actually for the athletes. So think about these things and just try to analyze these things, maybe to monitor, maybe to ask the players how they are sleeping. Is it okay or no? Is there any disturbances or no? So another point which I want to emphasize, talking about kids, yes, that researchers are telling that 4 reasons why kids should play multiple sports. So I don't want to say that you're supposed to just to change the training plan, but maybe think about the alternatives of training. Maybe think about the complexity or variety of the things. So it's very important. So those who have played multiple sports had fewer serious injuries. Yes. Also, about 88% of the NCAA players played multiple sports as kids. Yes, so fewer regrets from the NCAA and less burnout. So quite interesting data. Talking about training consideration for kids, actually the amount of training hours is very important. So age of the kid should be the maximum hours of team sports training per week. So 10 years old kid should have not more than 10 hours of training load per week. It comes all the competitions and the training sessions, everything, put it together. We should not cross that line because it's related with the health problems. Another very important thing which I want to emphasize, that muscular strength can be started to develop at the age of 5-6 years. Very important thing, yes. So muscular strength training should be done or incorporated into regular training 2-3 days per week with a day off in between. So don't forget to put some strength training exercises into regular training, and do it 2 or 3 days per week, but just do the break between the days. So strength training is about 30 up to 30% of one repetition maximum for slow twitch muscle fibers. From 30 to 70 is one repetition fast twitches, oxidative muscle fibers, and more than 70% of one repetition maximum is fast twitch glycolytic. So moderate intensity and high repetition exercises are more effective than weight training and low repetition training. So optimal number of repetition is from 13 to 15. Yes, repetitions in one set. And don't forget that if you want to improve your aerobic capacity, you should have minimum of 30 or 20 minutes of aerobical training. So if you want to improve that, the training session for improving cardiovascular endurance should be more than 30 minutes actually. If it is less, it's not training our aerobic capacity. And just short explanation about fast and slow twitch fibers. So fast twitch fibers, mostly like a sprinter, fatigue rapidly, but having quite fast muscle. And slow twitch fibers fatigue slowly, and usually the marathon runners are having slow twitch fibers. So actually every player is something like a combination of these things, but in most cases we have more fast or more slow twitch fibers. So every player is a little bit different, and the coach should use these muscle properties in a proper way, giving the certain role on the court for the player. And maybe sometimes it's good to have the player just for 10 minutes, but if he's very good in these 10 minutes, so we know that the time which is able to play in 100% is 10 minutes. If we are holding the player more in the field, that means that the effectiveness of the body is decreasing. So it's important to know these things. Also, we can do some researches, maybe some investigations, but most of the coaches can tell these things from the observational, from the experience. Yes. So physical literacy is very important, just active start and fundamentals and learning to train from 0 to 11, 12 years old. And here the most important things are fundamental movement skills and fundamental sports skills. Later on, starting from 11, 12 years old, we have training to train, training to compete, building physical and mental capability, and starting from maybe from 1918, high performance sports, when we are training to win. Of course, in some cases, everyone wants to win. If there is a game, if there is a match, everyone wants to win. But the main purpose of the coach is to provide some fundamental movement skills. Maybe start from fundamental sports skills for girls and boys till 11 and 12 years old. So a lot of things just needed to have to pay attention just for the development of the successful player. So family, social things, professional responsibilities, recovery, lifestyle, psychology, training, it's conditioning and technical practice, and we have just the cap of the iceberg. But a lot of things should be done before, just in order to put the athlete where, and from the athlete development go to the player development. So I think the successful career of the basketball depends from the individual characteristics, from the sport specific characteristic, and from certain circumstances. So these three things should match together to have the good and successful career. And you see, sometimes circumstances are very important. So we want to control as more as we can, but part of the things we cannot, and we have to know that. So dilemma is thus basketball drills are fitted with the muscular training. So my answer, there is no dilemma. We have evidence that strength training, proprioception training is having the biggest impact in reducing injury of risk. So it's very important. So it's not stretching, it's not other things. Strength training and proprioceptions are the main things, just which needed to be trained just to prevent from the injury. And some myths and facts about strength training for children. There is a widely held inaccurate belief that weight training, when performed during puberty and adolescence, can stunt one's growth by damaging growth plates. So it's myth. Actually, a number of researchers are telling that we can develop muscular strength for kids, and it's very important. And the benefits is increased strength, speed and power, improved body composition, stronger bones, and a reduction in injury rates. So, for example, when I was a kid, and then I was just attending the basketball school. So usually the coach at my time just said that, okay, don't do the muscular training because you will be small and you will be not growing up and so on. So actually, I think now we should say that, yeah, this is the myth, and in order to have full benefit, we should recommend and use the strength training in the development of the athlete. So there are some precautions of strength training. So be careful with the kids with cardiorespiratory problems. Also be careful with the kids after musculoskeletal injuries. It doesn't mean that you don't need to restore muscle strength, but in some cases, for some period of time, you should be avoiding this. So surgeries, fractures, tendons and ligament tears and sprains and so on. So there can be some limitation in strength training when the tissues are healing. Obese, overweight or underweight kids also should be under precautions, and of course there can be other reasons why we supposed to be in precautions. So I think the plan is just how to analyze these things and how to have the proper training load, use the questionnaires and develop the strategies. Don't be afraid to assess, to test, and collect the data. Evaluate these things, make a plan, start from the basic movement strength, physical fitness, then adjust the plan and do the combination of basketball, strength training, uh, endurance, speed, agility, and monitor the training load. That means that all the time check yourself, are you planning training load properly? So we have some data that overuse injuries affect many young athletes between age from 5 to 14. So in basketball, we have about 15% of overuse injuries, and usually it tells us that these injuries occurs only when we have the problem with the training load, and we are putting too much load on the body, which is not prepared for that. Yes, and another papers which are telling that maybe it's taken from the football, that coaches and players with more years of experience were less likely to adhere to the injury prevention program. So I think that young young coaches are the future of the injury prevention, because in some cases those who are more experienced are not paying enough attention to the injury prevention. So this is the fact, yes. So we have to understand that. So we know that exercises reduces lateral ankle sprain recurrences by 42%. And we know that bracing and taping reduces lateral ankle sprain recurrences by 62%. So that means that exercises and bracing and taping put it together can be a very nice prevention combination of the ankle sprain in basketball. So males are having 3.5 times more likely than females to rupture their Achilles tendons, with the 39 years being at the peak age of incidence for males. So also very important fact that we have to be aware of the any problems in the Achilles tendon, and the problem is that the majority of the Achilles tendon ruptures had the history of some symptoms before. So it shouldn't be neglected by the players and the coaches and the medical personnel that if there is a Achilles tendinopathy, so just persistent pain in Achilles tendon, which is lasting 1 year or maybe more, actually a very big risk of Achilles tendon rupture is if we have the situation like this. Also, we know that about 40% of first-time lateral ankle sprains develop into chronic ankle instability within 1 year. So that means that we have to be careful and just give enough time to heal the ankle sprain. It doesn't matter that maybe it looks not serious and so on, but just give it time to heal. If not, it's a very high risk to have this chronic ankle instability, which can reduce the performance of the player. And the 5 risk factors for sprained ankle is uneven surfaces, sports participation, previous ankle injury, improper shoes, and poor physical condition. So as you see here, the majority of the risk factors can be preventable. Yes, so it's not only the luck. And some interesting things in the papers which are showing that there are some ideas of the shoes and some models of the shoes which can prevent from the lateral ankle sprain in indoor sports. There are some data which are telling that the low friction shoes patch can be helpful in preventing that. So interesting things. The scientists are working together how to prevent these things. So talking about sports specialization, we see that the psychosocial, neuromuscular, neurocognitive, visual, motor things are very important in the development of the athlete. Mastery of fundamental skills, program variation, structured recovery, and progressive exercises, the main key things. So just to develop the athlete and to develop in a proper way. So injury prevention pyramid is telling that the background of injury prevention is load monitoring. That means that analyze how much you are giving the load and is it in the proper way or no. Later on, athletic development, movement efficiency, structured injury prevention programs, injury assessment and rehab, and at the top is just luck. Sometimes also just injuries are happening, and it cannot be preventable 100%. We know that some preventional programs. One of the most popular is taken from football, the FIFA 11 Plus, with injury reduction, and there is an evidence which is telling that this program decreased the total severe injuries by 58%, severe non-contact injuries by 53%, growth-related injuries related by 74%, and severe contact injuries decreased by 45%. So very promising data with very, very nice effects. And what is nice that the FIFA 11 Plus program, actually a lot of things from the injury prevention can be transformed into basketball, and we can use the same principle. So actually everyone can just look at this FIFA 11 Plus program and take some exercises from there and use in your own training session. It's very useful. It's evidence-based program, and it's not actually very football specific. So it's ready to go in other team sports. So what are my clinical insights here? That just remember that kids are not small adults if we're talking about youth players. As I said, develop an athlete, not a player. Monitor training load. So try to calculate how much load you are putting on your team. Be careful with training load during growth spurt. Yes, that means that during the growth spurt, it's very high risk of overuse problems. Yes, not because you are doing something wrong, but in certain time the bones are starting to increase much more faster when the muscles are catch them. So that's why a lot of tendon muscle problems are happening in that time. Injury prevention is just smart training, not hard. Don't be afraid of strength training. It's the key element of injury prevention. Use movement-specific functional tests to analyze the movements. And just remember that early sports specialization is causing more injuries later. So the complexity, the variety of the things are very important to use in kids training. Very important things. So that's all with my lecture, with my thoughts about injuries in basketball, and I hope that you will take some things and implement it into your practice. So thanks a lot for your attention, and you can find me an email on Facebook, Instagram. If you have any questions, feel free to ask. I hope that I will be able to answer them. So thanks a lot and goodbye.